Hi, everyone, and welcome to today's webinar. This is Matt Cottrell from Conance. I'd like to introduce Lori Jones, Conance's Chief Revenue Officer, just for a brief introduction.
Great, thanks, Matt. Hello, everyone, and welcome to today's webinar, What You Missed at A&I, Enabling Effective Management of Revenue Cycle Vendors and Processes Through Predictive Analytics. I am Lori Jones. I've been with Conance as Chief Revenue Officer since 2016, and I'm excited to be hosting today's webinar. Our presenters today are Jeff Korn, Executive Director of Revenue Cycle Services, and Matt Fisher, Director of Customer Solution Center of Piedmont Healthcare. Jeff has worked for Piedmont Healthcare since 2016, overseeing insurance billing and follow-up, patient financial services, and physician billing. Matt has also been with Piedmont since 2016, directing all self-pay activities of the single billing office, including the call center, financial aid, and scanning and indexing. Piedmont Healthcare has been a customer of Conance since 2016, utilizing Conance's agency manager, advanced propensity to pay, denial analytics, and presumptive charity solutions. So two things real quick before I hand the mic over to Matt and Jeff. We'll have time at the end of the presentation for you to ask questions, so feel free to submit those in the control panel of the webinar. And we will also be sending out the link of today's recording at the end of the presentation. So thanks to everyone for joining, and please join me in welcoming Matt Korn and Jeff Fisher of Piedmont Healthcare.
Thank you very much, Lori. Thank you, everybody, for joining the webinar today. This is Matt Fisher. I appreciate everyone's time for joining. Hopefully this is very informative to you and ultimately helpful, as it has been for Jeff and I at Piedmont. So I'm just going to go ahead and jump right into it. So quickly, a little bit about Piedmont Healthcare. If I can get to some cooperation here. Piedmont Healthcare is an 11-hospital system based in Georgia, currently the largest not-for-profit health system in the state of Georgia. We have about 2 million unique patient encounters a year. We're running about $3 billion net patient revenue currently, and then a realized $215 million community benefit. First thing I'm going to jump into today on our agenda is to cover our patient pay optimization. So this encompasses several different things with Conance, and I'm excited to share this because these really have been true value to us here at Piedmont. As we all know today, the patients are the new payer. The implementation of high deductible health plans, which has become the norm across our industry, we have to recover more and more dollars from our patients every single year. We only expect this trend to continue to increase across the next 10 years. So getting every penny we can from our patients at the appropriate time is what's going to continue to make us successful as healthcare organizations. Some of the challenges that existed prior to our implementation of Conance back in 2016 was we had an inability to accurately identify patient population and ability and willingness to pay. We also had an ineffective outreach strategy for communications and collections. We had lack of clarity and insight into our collector productivity, specifically with our business partners. We had a very manual process for identifying our charity eligible patient population. We also had lack of insight into the percentage of patients that would qualify for charity at the facility levels when they came in the doors. The presence of those challenges made Conance's advanced propensity to pay tool very attractive to us. So Conance's advanced propensity to pay, or if you hear me say advanced P2P, I'm referring to propensity to pay, that gave us the ability to predict expected cash value and how much people will pay and how to prioritize those accounts. It also predicts payment pattern behaviors. It helps me as the director of self-pay to guide my most effective follow-up and to figure out when and how is the best way to engage the patient in the early out cycle. It also connects segmented workflows to drive our collection ROIs. We have a partnership with an outsourced early out company, so we outsource a percentage of that to us. We can line all of that up into one seamless patient experience and connect all of those segmented workflows. It also gives us access to national benchmark database for absolute and relative comparison on how other agencies are performing if I'm ever interested in going out to RFP with another business partner. So kind of the nuts and bolts of Conant's advanced propensity to pay solution is their intelligent segmentation. This segmentation separates accounts based on relative economic value and follow-up behavior, which is the core to our collection ROI. Each account is run through the intelligent segmentation analytic and is assigned a value of 1 through 5. The 1 through 5 correlates to the patient's payment behavior as well as a combination of the expected cash value of the account. So I use this data coming back from us to determine what I outsource and what I insource. I outsource about 40% of my self-pay volumes today to a business partner. Currently, that business partner gets segments 1, 3, and 5. Segment 1 is that low payment behavior with low cash value. Segment 3, still low payment behavior, and you can kind of see how it progresses across the chart there. We've chosen, based on our model, to outsource segments 1, 3, and 5 at day 1. That is more challenging inventory to collect on. And then my team keeps segments 2 and 4 in-house for the full early out cycle. These are kind of our wait and watch, more self-directed patient population that's likely to engage on their own. So this data is very valuable to us to determine when and where we want to contact the patient. Some of the challenges that we had when it came to assessing our charity eligible population had a number of factors contribute to that. And ultimately, we had trouble accurately determining if a patient lived in poverty or not. We had a tool in place at the time, but unfortunately, it was just not robust, and it involved an extensive manual workflow surrounding it. So we had unreliable third-party income estimates from our sources. Our credit bureaus don't accurately cover a large segment of the population, including those that kind of live in the financial shadows. Could be undocumented. They could be paid in cash. I mean, there's tons of variables there so the credit bureau insight didn't give us exactly what we needed to. And then bad credit does not equal poverty, nor does good credit equal affluence. The functionally illiterate also could not complete an application. We ran into that actually with a large segment of our homeless population. And then there were cultural barriers as well, as I'm sure many of you are familiar with, for a reasonable sized portion of our population. So we chose to implement Conant's presumptive charity analytic. This leverages databases with more than 9,000 sources and 2 billion records. All of this is public record database. It gave us multi-level prediction to identify people living in poverty. The primary or the socio-demographic model proven to correlate to poverty is called the PARO score. And the secondary is the income estimate to confirm the PARO score prediction, and then the tertiary is the asset check. All of these together return a value back to us that gives us a predictive eligibility that we can stand on and be very comfortable with, and also compliant with 501R in order to write off patient balances presumptively, not having to have these patients apply for charity on paper. Again, fair, consistent evaluation against our financial assistance policies. We recently went through a 501R audit, and we're very successful. When the auditors looked at all the PARO scores that came back, PARO was able to provide us with everything that we need to stand the test of the audit. We passed with flying colors. The other benefit to the PARO presumptive charity process is it is deployable at multiple points to automate process flow. We can put this in at any point of service location, give your registrars or your financial counselors access into the PARO portal, and they can manually run a PARO score to determine a patient's eligibility for charity prior to the patient even ever rendering services. This was beneficial to us because then we can control to an extent what actually comes in the health system. If they're coming in for an elective procedure and they can't pay, we can run a charity score on them, and we have a process to go through to determine if we want to let that elective procedure come in the doors or not, knowing they're charity eligible. And then lastly, it's also calibrated to local market and facility specific policies. Continuing on down the road for presumptive charity, this predictive solution to review every account prior to bad debt placement gave us the ability to comprehensively evaluate every account in a consistent fashion. So the way that we took the approach was we evaluate all of our self-pay patients at day one, that the balance becomes self-paid liability. And then we evaluate all of our balance after insurance patients the night that the account would qualify to go to bad debt. So the intervals that we have between the two are very successful and very efficient because I can let my charity population that's uninsured be evaluated right up front, and then my insured population can go fully through our early out cycle. And at the point that it goes to bad debt, if they are presumptively eligible for charity, we're going to write that account off to presumptive charity in lieu of placing it with a bad debt agency. What this has done is given us the ability to place more valuable accounts with our collection agency. We're carving out the charity eligible ones right off the top before it ever even goes out to bad debt. So some of our key strategies for improving patient pay, we were able to utilize the intelligent segmentation driven by the predictive analytics for determining the propensity to pay. We were able to determine charity early on in the collection process through the predictive solutions. This reduced our resource efforts needed to manage our charity population effectively. We were also able to leverage the advanced propensity to pay scoring for our Dialing for Dollars initiative. So let me touch on that real quick. We were able to take the intelligent segmentation that you saw a couple of slides ago, the segmentations 1 through 5, and we were able to assign an outbound dialer campaign to certain segments of that population and reach them at defined intervals to engage them during the early out cycle before their account is placed with a collection agency. We have seen nearly a 5% lift in just the last 6 months in patient cash just for Dialing for Dollars. This is us actively engaging the patient in the early out cycle based on the advanced propensity to pay analytic. Lastly, this has also given us the ability to improve the identification of the charity population. And then also, again, like I mentioned a second ago, we improved our efforts in placement of bad debt because we're placing more valuable dollars to bad debt at this point, having carved off the presumptive charity from the top. So really, in our case, solutions met results here. We've had a $5.6 million yield and improvement. That's an increase in our annual net patient collections. We've had a $240,000 increase in patient pay productivity. We've also had a 10 to 20% improvement in call time. This 10 to 20%, I know what some of you may be thinking, well, why is it 10 or why isn't it 20? Our improvement in call time is seasonal. We have our peaks and valleys seasonally throughout the calendar year, but we've seen as low as a 10% and as high as a 20% improvement in our call times. My team is able to more efficiently handle phone calls because more data is available on the screens when they have the patient on the phone. And then $147 million in community benefit from there. This is, again, going back to our PARO and our presumptive charity analytic. As a not-for-profit hospital, this is what we do. We serve our population in the form of free and reduced health care for those that can't afford it. So at this point, I'm going to pass it over to Jeff Korn, Executive Director of Patient Financial Services, and he's going to jump into our denial and underpayment optimization.
Hello, everyone. This is Jeff Korn. I'm going to talk about our denial and underpayment optimization and our non-self-pay partnership experiences since our Conance implementation. So, you know, third-party payers are doing a very good job of denial, and if you believe or not that that folks in Washington are possibly colluding, I firmly believe that there's a lot of collusion and a lot of I'm starting to see artificial intelligence creep into this realm. I'm starting to see a lot of uptick in very complicated decision making to get to some of the denials, and brand new denials all the time. So we see about $3 trillion in the industry nationally, and in claims that were submitted, and about $262 billion or 9% that are denied across the industry. It equates to $5 million average per hospital, but the real thing that we wrestle with, and I think all of you all do as well, is the estimate that it costs about $118 to appeal each denial, and there's lots of expenses that go into that, as you all can calculate, not only the raw labor costs, but cost of money, etc. And the yield from these denials is $8.6 billion in increased administrative costs and cost to collect benchmarks that we all try to measure ourselves against. So we started using Conance since 2016, early 2017, in terms of our automated claim statusing solutions that we get. Conance retrieves payer website claims data and returns two things to us: analytics in the form of performance reports by payer, and actionable claim status files. These two results eliminate some of the touches that we do on our accounts in the third-party arena. Through this automation, we're able to automate other things in our Epic patient accounting system as a result of the messages that come back, the information that comes back. We can accelerate our claim resolution by it eliminates some remittance data turnaround times. We're not having to wait on just the remittance data coming back. We can take action, more robust action, in a more timely fashion, and also get some very good reports by payer to monitor what's going on with the type and numbers and the culprits in our denial management area. So we also have analytics, as I mentioned. We're using predictive analytics to kind of change our workforce productivity, our operating models, or our standard processes in how we combat this denial issue. What we do is we kind of go in and identify through the scoring, if you will, the claims that are likely to generate most of the revenue. It enables us to more effectively strategize with our vendors. Those vendors that I'm referring to are mostly our small balance third-party account outsourcing partners. I'll give you an example. We use two small balance insurance account vendors, and that has really proven to be very, very helpful in increasing. I'll go through some of the numbers in a minute, but increasing our collections and denial recoveries. Some of the reporting that we get is down to the root cause level. It helps us not only prevent future denials, but look to the real reasons that actually cause the denials, as opposed to just relying on CAS codes, etc., but get down into the operational root causes. We also have enhanced cash through these claims analysis, and our denial resolution analysis for payer timing helps us predict cash recovery, and we also use some of this information in our managed care contract negotiations. It's kind of like, how much rework for both sides, the payers and for us, and use that information when we renegotiate contracts or have other meetings with our payers. So some examples you can see from the graph below with certain payers in our claim statusing solution with Conance. It's been in place for past year or more, and Piedmont has measured a 58% reduction in the manual claim statusing workload, and conservatively up to $96,000 in manual cost savings just from the staff perspective, letting them work on more important things. So the blue line here indicates from our baseline that we started with what would have been in the manual statusing work queues, and the orange line depicts what was removed from those statusing workloads as a result of the claim status solution that we have. So some of the solutions that have resulted in improvements through our denial analytics. As I said before, Piedmont has used small balance outsourced partners as an extension of our PFS shop, and through these denial scoring returned information, we're more prescriptive in our placement. Thus, we save a lot of commissions, and we're able to find the high-value denials. We have found, the high-value denials account for 22% of the number of denials, but generate 85% of our recoveries. And in the underpayment arena, those high-value accounts are about 41%, but generate 88% of our underpayment recoveries. So we're able to save in some of the commissions that we pay based on what we place with our partners. Some of the key strategies or benefits that we've gotten, to summarize some of those, we've got better use of payer-specific strategies for follow-up activities. We've reduced the payment cycle by taking action sooner on likely denials. We were able to add actually a champion challenger strategy through the use of agency manager that Matt's going to go back into a little more detail on in a minute. But the management of those vendors, we were able to add a second one for a champion challenger strategy for the small balance outsourcing area and maintain accountability for not only the claims but also for vendor invoicing, another area of cost savings. We've also been able to improve the speed in adding third-party partners, such as MBA and workers' comp. We changed MBA or motor vehicle accident vendors to a Conance-enabled full-service partner with very strong results. We did that back in November and have just seen very enhanced collections there, a lot more than we anticipated. We also outsourced the niche and technically difficult management of workers' comp claims, again with very good results, much better than our internal team achieved. We're just not, we're just not in that niche business, and we were able to do that through the connection that both of these new partners had with Conance. So I'm going to hand it back over to Matt so he can talk about agency manager and some of the partnership performance and relationship management that we get from that solution from Conance.
Excellent. Thanks, Jeff. So one of the other very valuable functions of Conance that we have is their agency manager platform. So this user interface gives me access at the click of a button to my agency's performance, their reconciliation, their cash collections, their aging, all of their AR snapshots. I mean, all of this I can see in one location, and we're managing multiple different agencies off this singular platform. So really it gives us the best state or status of that vendor relationship. We believe in relationships, we believe in the business partnership, so I mean, we want to be able to hold our vendors accountable, and they want to perform the best that they can for us. The agency manager platform gives us the ability to do all of that in kind of a one-stop shop. So it provides us the administrative access. A lot of the questions out there, how do I get a single source of truth to manage all the accounts that we're outsourcing? And we're outsourcing quite a bit in multiple different arenas. Gives us visibility into those. Again, I can see all of my reporting for all of my agencies and business partners in a singular place. It promotes the trust between us as well. Fortunately, we have very solid relationships with our business partners. I do trust what they're doing, and then the information and the reporting coming out of agency manager just validates that trust. Ultimately improves the patient experience as well. As I mentioned a little while ago, we outsource a significant portion of our early out to a business partner. We don't necessarily want the patient to know that there's an outsourced relationship there. Having the seamless communication through the agency manager platform with my business partner improves that patient experience. Again, the business partner can adhere to our standards. We can be responsive and timely in all the requests that come through, and the patient is none the wiser that we're outsourcing their inventory. So some of the challenges that we had in place with our vendor management prior to the Conance platform was the inability to identify invoicing errors, as well as complete and accurate inventory. This reconciliation process was done on an individual basis per vendor or per business partner. So there was a lot of manual work that was done every single month to validate invoices and to reconcile inventory. We also acknowledged that we were paying double commissions. Certain business lines that are outsourced to business partners that could potentially overlap different duties on the same account, we were double paying commissions for some of the same services as well as for some of the different services. One of the benefits to agency manager is agency manager will only let an account live in one place at one time. So we have substantially reduced paying duplicative and ultimately triplicative commissions in some instances. We had lack of reporting into vendor performance. We got performance decks from all of our vendors on a monthly basis, but having the inability to completely reconcile that inventory prior to left some of the reporting lackluster at best. We also had the inability for the reconciliation of the account placements. So we're an Epic shop. Epic, at the time, before we built it out and optimized it for Conance, we had accounts that were placed with agencies that may not necessarily have had an agency code identified in Epic. Again, like I mentioned a second ago, Conance will only let an account live with one agency at a time. So we can truly reconcile what's where and who has what inventory and at what place in the revenue cycle. And then lastly, we had manual claim status feedback, like Jeff was mentioning earlier, and manual work queue processing for his denials and insurance follow-up team. So Conance Agency Manager, again, is that singular user interface that I can go to check anything at any given time. So currently today we've got 6 vendors on the Conance Agency Manager platform. I've got an early out vendor, primary bad debt, secondary bad debt. I've got the motor vehicle accident partner that Jeff mentioned a minute ago. I've got 2 small balance insurance companies, and then our work comp vendor as well. So the performance analytics that we get back from Agency Manager allow us to gauge and compare agency performance, inventory status, and liquidation on a true apples-to-apples basis. The analytic integration gives us the ability to look at our advanced placement logic, including our presumptive charity and our cash value segmentation. I can go into Agency Manager at any point, understand what has been adjusted thus far this month for presumptive charity. I've got the historical data there as well, and I can also take a look at our overall segmentation or distribution of segmentation for our propensity to pay or our cash value segmentation analytics. The invoice verification tool gives us the ability to automate the audit of agency invoices and simplify the monthly forecasts. Again, as I mentioned earlier, we were able to avoid duplicate fees and errors in invoices that come across. The invoice validation has given us just a invaluable insight into our invoicing, to where now very little time has to be spent each month on validating agency invoices. Probably one of the most valuable for me, is the communication portal that Agency Manager provides. Gives me that singular location that I can communicate with all of my business partners in one location. I can put accounts and work queues for them. They can put accounts and work queues for me and my team to handle. Same on Jeff's team. We can communicate everything that we need to through the Agency Manager platform. Gives full insight and transparency into the status of those communication requests either. Takes the communication out of email, puts it in Agency Manager, and lets us do it that way. It has really simplified our communication process with our business partners. It also has a performance coach product. This gives us the ability to identify performance improvement opportunities, comparing ourselves to other clients that are on the Conance network. So a little bit ago, I mentioned that the Conance tool gives us the ability to see how other vendors are performing. That's really valuable to me in the event that I ever go out to RFP. So Jeff and I both went out to RFP last summer for different services. So I engaged Conance to give me high-performing vendors that were already integrated on the Conance platform, and they provided that information back to me, and that's who we included in our RFPs. These vendors had the ability to seamlessly integrate because they're already on the Conance platform. It took our onboarding time and cut it down substantially. So the lift from our IT team that was required was nothing compared to what it would be if we did not have Conance in place. So that kind of capitalizes on the last point here, which is the expanded network of connected agencies. It gives us that transparency into how these agencies are performing for clients all across the entire country. The actionable reporting that comes out of Agency Manager, again, a very valuable tool here. This advanced reporting and analysis puts everything in an apples-to-apples comparison based on activities, issues, and performance. It is truly a one-stop shop for us to look at collections, activity, and issues. So when you say activity, okay, well, what's that mean? It means I can go into the Conance Agency Manager platform and I can see how many statements my early out partner mailed, how many statements my bad debt partners mailed, how many phone calls my bad debt partners mailed. I can see every activity that my business partners have taken on my inventory. That activity function gives me full transparency into that. And if at any point there's ever a question there to say, hey, how come you only made one phone call in 180 days on this batch of accounts? I can ask those questions because I've got the data to back it up out of the activity function in Agency Manager. So some of our key strategies for vendor management, we were able to utilize the proactive monitoring and management solutions for outsourced collection agencies. Going back to what I was mentioning earlier, I can have these proactive conversations with my business partners if I start to see a trend ahead of time, and I don't have to wait until our monthly or quarterly business review meetings to have these conversations. We're able to enable robust reporting for insights into vendor activity and invoice management. Again, we've had a $250,000 savings in invoice integrity thus far, and we've been live on the platform for about 1.5 years at this point. We were able to identify an opportunity to outsource less. This was very valuable to Jeff and I when we looked at our outsource strategies, and we originally placed or built our placement strategy around the Conance advanced propensity to pay segmentation that came back. Well, I have just recently identified another strategy to outsource less early out. It's going to save us a significant amount of money. We were able to do that based on the reports and the feedback and the analytics coming back from Conance and the Agency Manager platform. And then as Jeff and I have both done, we're able to challenge our vendors in that champion challenger type format and ultimately hold them accountable for performance, which just promotes a great business relationship. So again, I want to personally thank each one of you that took the time out of your calendars today to sit through the webinar. I hope it was helpful and informative. I think at this point, I'm going to pass it back over to Matt Cottrell with Conance. I believe we're going to open up for questions or comments.
Thanks, man. Thanks, Jeff, for your time today. That was really informative and interesting. We did have a couple of questions come out, and the first one was actually in reference to advanced propensity to pay, and it was just, how did you originally decide what to outsource and what to keep in-house? Was this a best practice recommended by Conance, or was this something very specific to Piedmont?
Yeah, that's a good question. So we did base our original outsource model off of recommendations from Conance. So we took a look at what similar organizations were doing and which segmentations, I should say, they were outsourcing. And we chose to outsource the segment one as the low propensity, low performing. That one seemed to be a no-brainer to us. But then in collaborative conversation back and forth with Conance, we also decided, due to some internal capacity restraints that we had at the time, I couldn't handle the rest of the segmentation when we went live. So we chose to outsource segments 3 and 5 at Conance's recommendation.
And has that progressed or changed any since you guys went live?
It has progressed. So in the previous slide, when I was mentioning the ability to in-source some, we're actually going to undergo an exercise here, and we're going to take off some of the segments 3 and 5 and actually not outsource those, because we've identified an opportunity for a significant cost savings if we work those in-house and not pay the collection fees to our agency. I can actually do it for far cheaper internally on certain portions of those segments than outsourcing them.
Great, thank you. The next question was just about agency manager. And when you guys have moved over to agency manager, how was that accepted by your collection vendors? How about your internal team?
Yeah, good question. So fortunately for us, the agencies that we already had partnerships in place with at that time already had the interface to Conance with other of their clients. So they were very receptive to the idea because it was an easy lift for them. So for example, the early out business partner that Piedmont has had for many, many years already was on a client of Conance. I say client. They already had clients that utilized Conance, so that agency already had that interface built. So for that agency to build out the interface with Piedmont was really not a lot of work. And Matt, what was the second part of that question?
It was just, what about Piedmont's team? How was the adjustment moving to agency manager for all of your employees?
Okay, great. Yeah, so we actually have the luxury at Piedmont of having a vendor management team. So our vendor management team had analysts that were assigned to each respective vendor. So those analysts spent a ton of time every month validating invoices, going through performance reports. The Conance Agency Manager platform has made our vendor management team's job function much, much easier. It was well received by everyone.
Great.
Hey, Matt,
go right ahead.
This is Jeff again. I'd like to add to the first part of that. While Matt's vendors all were already Conance connected when we installed, since we installed Conance on the PFS or third-party side, I have partnered with three companies, and in that selection process, we required any new vendors to be Conance connected, and in all three cases, none of the three that we ended up choosing were Conance connected, but they agreed to become Conance connected, which we were, not only did we require, but the point of this is that those three companies had a good experience getting it implemented, and it didn't cost them a lot of money. The first questions that I got was, well, how much is this going to cost us, and cut into our, their profit margins. And it's low cost on the front end from a monetary perspective, and the effort to get connected is a technical one, and a little bit of IT type work, but not difficult. And they found it to be very palatable. They told me after they got up and running. But it's the only way that any vendor is going to get our business, because it does provide so many benefits to us on our end.
Awesome, because that actually that also answered the next question, just about whether or not you had any collection vendors that weren't connected. to agency manager at this point? I'm assuming from that comment that everybody that you work with is now connected.
Well,
That's
so we
correct.
we don't have any collection vendors that are not connected. We have other vendors that are not connected, and the reason behind that is that connecting those vendors, it is just not valuable to us. So any vendor that touches or has anything to do with collections is connected.
That's great. And then just the last question was about presumptive charity. And it was just around whether or not you were worried about missing out on revenue that could possibly be collected easily, rather than putting it to charity itself.
Yeah, that's a great question. Actually, that's something that we had entertained for months prior to go live with Conant. As a not-for-profit organization, we struggled, in full transparency, we struggled meeting charity thresholds at certain facilities, and more specifically for certain service lines. We have charity thresholds that we need to hit for our CONs, for certain service lines, and then ultimately at every facility. It was more valuable to us to have the charity dollars and not be at risk of paying a fine or a penalty to the state for not meeting the CON threshold than any cash collections that have come from that.
Interesting. That actually that does it for the questions that we have. I do appreciate your time, and if anybody has any further questions, feel free to reach out to us. We're going to be sending out an email with a copy of the recording for everyone, and I hope you all have a good rest of your Thursday. Thank you.
Thanks, everyone.